I'm Dr. Persaud, and today we're going to talk about diabetes. There are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes means you get it at the first stage of life, meaning you are born with it. These are children who are insulin deficient. They are born with a pancreas that does not make insulin. Type 2 diabetes means that you get it in the second stage of life. That's what the 2 kind of helps you remember. These are people who, as they get older, their pancreas does not make enough insulin, or whatever insulin they're making is not sufficient. Why is this even important? You see, every organ in our body needs sugar to function. That's how the organ works. So let's say the liver, for example, is made up of a bunch of hepatocytes. Those are little liver cells. And for those cells to work, they need energy to work. That is used in the form of glucose, which is another word for sugar. When you eat something, it gets broken down into sugar. That sugar then floats around your bloodstream. But how does the sugar go from the blood into the actual organ? How does it cross over from the blood to enter an organ? The eye, the heart, the lungs, the liver, the skin, any organ you could think about. The answer to that is insulin. Insulin is a key that opens up the cell to allow glucose to enter the cell. So once again, insulin is a key. When there's enough insulin, that key opens up a cell to allow sugar or glucose to go from the blood into the organ of the body. So if there is a lot of glucose in your blood, that means you have diabetes, meaning the sugar is not entering any cell of the body. It's just circulating around in your blood. You are then going to pee it out, so there's going to be glucose in your urine. These are all signs of diabetes. If someone is checking your labs and in your blood has a lot of glucose, that means you are at risk of developing diabetes or you already have diabetes. The normal number of glucose in the blood should be 100 or less. Anything above 100 could mean you are pre-diabetic, and anything above 126 means that you have diabetes. As you start to gain weight, obviously if you have an extra 100 pounds on you, that's an extra 100 pounds of cells that need glucose to enter those cells. But the pancreas maybe cannot make enough insulin, so it can't make enough keys. So when you're eating, the glucose just stays in your body because there's not enough keys to open all the cells of the body to get rid of the glucose, so it floats around the blood. So 2 things your doctor can do. 1, start you on diabetic medications or start you on insulin so that you have a match between how many keys, so to speak, that's insulin, and how many cells in the body. Or just decrease the number of cells in your body, meaning lose some weight. If you lose weight and you burn off those fat cells, or you're literally losing 100 pounds, you don't need as much insulin. You don't need as many keys because there's not as many doors. So the glucose can get absorbed easily by the pancreas making the insulin, and you don't need extra insulin. That is why on our diet, we tell you don't eat any extra sugar. If to begin with, you have high sugars floating in your blood, you don't want to then add more sugar into the bloodstream. So be aware of that. So the first thing diabetics should do is avoid sugar. Sugar is anything that ends in OSE. So glucose, sucrose, sucralose, lactulose. These are all different types of sugars. Stevia, honey, aspartame. These are also different types of sugar. Your body interprets them as sugar, interprets them as energy. They get broken down into glucose and it floats around your bloodstream. If you are diabetic, as a diabetic, it's very important to figure out what damage is the extra sugar doing in your body. If the sugar is floating around in your bloodstream, it will start to sit on the fingers and toes, the nerves of the fingers and toes, and you will develop diabetic neuropathy, meaning the nerves are getting damaged. If the sugars begin to sit on the eyes, you will get diabetic retinopathy, meaning you will start to get blurry vision. Diabetes affects from the head to the toes. In the brain, the sugar can cause brain damage. It puts you at risk for strokes. In the heart, it can cause myocardial infarction or heart attacks. It can slowly damage the fingers and toes, as mentioned in neuropathy, and it could damage the kidneys as well, which is nephropathy, diabetic nephropathy. So be aware, you don't want to have more than 100 sugars floating around your bloodstream. That is why when people get placed on insulin or diabetic medications, they tend to start gaining weight. The reason for that is the sugar that previously was floating in their bloodstream is now getting absorbed into the organs. Those organs, now that they have enough energy, are going to start to grow. So people gain weight. As opposed to when someone has diabetes, meaning their pancreas is shutting down, they are not producing much insulin, the glucose will float around their body. No organ will get to absorb those glucose, and the organs will start to shrink, so to speak. They can't function properly. So one of the first signs of new onset diabetes is weight loss. The person's also very thirsty all the time because there's a lot of sugar floating in their body, and sugar will cause you to feel thirsty. They will also urinate a lot. That's the body's way to try to get rid of all the sugar floating in the bloodstream. So people tend to have a lot of urination and thirst when they have diabetes. Additionally, they have weight loss because although there's a lot of sugar in the body, it's not actually being absorbed into anything. So these people tend to be hungry all of the time, and no matter how much they're eating, they're not full because again, the sugar is floating in the bloodstream but not getting absorbed by any actual organ. You need insulin in order for sugar to be taken out of the bloodstream and to go into an organ. As you get overweight, the insulin does not function as well, and you need more and more insulin for the more and more cells of your body, so it doesn't work as properly. These are some of the main causes of diabetes, is just eating a lot of sugar and then gaining a lot of weight so that your body can't keep up with your weight gain and can't make enough insulin fast enough.